Now, the big thing with B12 is that there's so many people I've worked with that are in the range, but then you give them a B12 shot and they still feel way better.
Introducing the Paramena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Paramena Bliss Podcast.
Hey, this is Doc Yates. Welcome to the Paramena Bliss Podcast. Thanks for joining me on my drive to the clinic this morning. And today I want to talk about B12. So, the majority of my clients that I work with are in perimenopause or menopause, the vast majority. But along with that, a lot of them come in for the weight loss program. So beyond just balancing hormones, I'm doing a lot of work with weight loss. And one of the things that we do in our weight loss program is that we do use a lot of B12, typically, most commonly in injection form, sometimes orally. And if we're doing orally, well, sometimes we do sublingual or just regular swallow the pill. What I have noticed, because some people are like, what does that have to do with weight loss? A lot. It makes a huge difference. If it didn't, I wouldn't be wasting my time doing it. And I've been doing consistent B12 shots, like for us to do 20 B12 shots a day plus for the last 10 years. So we can do the math on how many we've done for that. It makes a big difference. And today I want to talk about what are some of the big changes that I see in clients when especially if they're low B12 or if they needed more B12. Because again, sometimes they just need more. They show up, they get the test done, they're like, no, the test says I'm at 250, therefore I'm not deficient. You give them B12, they're like, holy crap, I feel way better. So, you can't always just go by the test. I've seen other people who are even slightly high on the test. They're over 550. And they still feel better with a little bit more B12. And the nice thing with B12, like people are thinking, well, can't you overdo B12? No. Like your body will get to a certain point, which is generally around 1400 when you're testing. And then it's just going to pee out the rest. But so many clients, they just feel better when their levels are up around 1,000. Like their energy's better. Well, you know what? I don't want to give it all away. Let's go through it. These are some of the top things that I find that people feel when they're using B12. The big one is energy. Their energy, people with low energy, I'm always wondering about, is it a thyroid issue? How is your sleep? But then I'm always wondering about iron deficiency and B12. When it comes to B12, typically rather than test it at this point, I will give someone a B12 shot. And then that is my test. I have them pay attention to their energy for the next 24, 48 hours. And if they notice an improvement, because the nice thing with that, doing it that way, is quick, then I know that regardless of whether they were low, whether they're high, they just need more B12. And chances are, sometimes they're already taking B12 and they didn't notice the benefit, then I know they're probably not absorbing it that well. Because the big difference is with the shot is like it's 100% absorption. It's all going into your muscles and bloodstream. Whereas when you do orally, or if you're just trying to eat B12-rich foods, or depend on your bacteria in your stomach to make it for you, that's not going to cut it. So it makes a big difference with energy. And I want to differentiate. It's not like coffee energy where you feel jittery or wired, that type of energy. It's not like you drink a coffee or chug a Red Bull. It's like you feel motivated. You don't feel like you couldn't sleep. You don't feel wired or jittery. You're like, no, I normally get home and I want to lie on the couch, and now I'm like, oh, is that laundry need done? Okay, perfect. Oh, I need to put away do some dishes and stuff? Perfect, I'll do it. You just do those things. Now, the next big thing is it does make a difference with metabolism. Now, I would not say that you could only come in and do B12 shots and lose weight and do no other changes. That would not be my recommendation. That being said, I do have clients who that's exactly what they've done. They just find that when they're doing the B12 shots, the weight's coming off. Because for a lot of people, it makes a difference with their metabolism. It plays a role. Some people, it's like they burn through it. I've always noticed clients that are under more stress, whether it's work stress or family stress, or like family stress because of a lot of times I hate to say, a lot of times with divorces and separations, that ongoing being dragged out, that type of stress, people just need more B12. And when you give them more, they do see benefits with weight loss, even if they're not doing the diet. Again, I'm not saying this is a magic pill that, you can eat whatever you want and lose weight, but it makes a big difference. Hair. Females, perimenopausal females, and their hair, if it's thinning out, you always want to check for B12. Especially too, if you're dealing with clients that are vegetarians or vegans, they're way more likely to be low in B12. I'm not saying that you can't get B12 by eating a vegan-rich diet, but you need to be on it. You've got to be nailing it. You've got to be taking in all of those little superfood, power food, yeast, bee pollen extracts to make sure that you're getting it. Because otherwise you're probably not. And people are like, well, I've been vegan for like 4 months and my levels are fine. It takes a long time for your body to fully deplete those levels. And if you get to the point, I had a client very recently. No, let me just bypass. If you get to the point though that your hair is thinning out and it's because of B12, you're too far. Like, don't let it get that far. That should not be the measuring stick for when you need B12. So what you want to do is make sure, if you're having difficulties with your hair, check B12 or take some B12. Biotin is another B vitamin. Iron plays a role. Of course, you're going to be working with the hormones because this is the Perimental Bliss podcast. The next one, dry eyes. The number of clients that I have seen who have chronic dry eyes, which you would always be like, oh, maybe it's allergies or maybe they're sensitive to dust, that it goes away after a few B12 shots, it makes a huge difference. So sometimes even when dry eyes are related to medications, like, I have dry eyes ever since I started that medication. And sometimes they can't stop those medications. But here's the thing. Sometimes the medication causes dry eyes because it depletes certain nutrients from your body, one of those being B12. And when some people, you give them B12 shots, they're like, you know what? Like, my eyes used to drive me crazy and now I'm fine. So I've noticed that quite a bit in practice. Here's another one that makes a big difference with food cravings. So I feel like this is a big factor why it plays such a role for the weight loss program, is that when you start giving people B12, their cravings and sugar cravings drop. And it's a lot easier to lose weight when you're not craving sugar and carbs every evening when you're supposed to be getting ready for bed and you're mowing down on snacks. So pulling back get the B12 up, pulls back on the cravings, helps the weight come off. So it's another kind of side benefit. It's like the energy, metabolism, and the reduction in cravings. Those are the biggest things that I tell people. Like, why do we use B12 for the weight loss program? Energy, metabolism, reduce cravings, and you consistently will see that. Finally, muscle pain. When you're low in B12 or low relative for you, you'll see increased trigger points. So very common clients with, say, fibromyalgia who have a lot of trigger points, or people just with general muscle tension, I always try some B12 and magnesium. We're always doing magnesium for that too. So again, it's not like it's we're going to use just ever one thing, but I do want to make sure that we get some B12 in there. And people generally find, even though they get energy from B12, they generally find that they sleep better and they feel more refreshed, but yet more relaxed. It's pretty rare to find something that can give you energy but make you sleep better and feel more relaxed. B12 is one of those things. That's why we love to use it. So I hope this information was helpful. This is based on thousands and thousands and thousands of B12 shots at our clinics at this time and seeing how people respond and the benefits. So I hope you can learn from this and it was helpful for you. This is Doc Yates signing off.
Thank you for tuning in to the Perimental Bliss podcast. Don't forget to hit the subscribe button and visit perimentalbliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Perimental Bliss podcast.